This is the Perineal Care skill for state. The supplies that I'm bringing into the room are a barrier, my gloves, an incontinent pad, a bath blanket, a towel, and 4 washcloths, 2 for the front and 2 for the back. Let's begin. Hi Kendra, my name is Cindy. I'm here to do perineal care. Is now a good time? And she says that it is. So I'm going to set my supplies down, starting with my barrier. Next, I'm going to sanitize my hands, rubbing until dry. Then I'm going to pull the curtain for privacy. Next, I have to make sure that my bed breaks are locked. I have to put this incontinent pad underneath my resident, and so to protect myself, I'm going to put my gloves on right away. Kendra, I need to put this pink pad underneath you, so I'm going to help you roll to your side. The white side of the incontinent pad is the absorbent side, so we're going to put that up, and the pink side is waterproof. And on the count of 3, we're going to roll over onto your side. 1, 2, 3. If the incontinent pad is lined up to the edge of one side of the bed, it'll automatically fit. It's perfectly fitted for a twin size bed. We're going to roll back. There's a bump. 1, 2, 3. I'm going to cover my resident up and walk around to the other side. And I'm going to unroll the incontinent pad the rest of the way. I'm going to help you roll, Kendra. 1, 2, 3. Next, I'm going to put the bath blanket on my resident to keep her warm during this skill. I'm only going to put it on her upper body. And I'm going to leave this here for right now. When I get back, I'm going to pull the sheets down to her knees. We're going to keep her warm. I'm going to go to the sink and get my water. I'm putting my soap on the barrier. At the sink, I'm going to use a paper towel to turn on my water and adjust the temperature. That feels about right. And I turn off the water with the paper towel as well. Whenever I'm working with water, I always bring the basin to my resident and ask her to test it to make sure that she thinks it's the right temperature too. Kendra, can you test this water for me, please? She says it feels just right. I'm going to put my basin on my barrier, and then I'm going to move everything in my environment around so that it's within easy reach. Now that I'm back with my water, I won't be leaving for a while, so I'm going to be raising her bed height up to about my waist height. I would not have done that before I got my water because I would never want to leave my resident in an unsafe situation. I'm going to ask Kendra to hold on to this bath blanket for me while I pull the sheet down to about her knees. We don't want to expose her feet because we want her to stay warm. I am going to expose her perineal area, and I'm going to help her frog her legs. After she's frogged, I'm going to tent, and I'm just moving this sheet out of the way so that you can see. I can only expose my resident from the hips to the knees. Next, I'm going to put the drip towel in place, and I'm going to use this to dry her off. My first 2 washcloths are going to be for washing the front of my resident's body. Let's start with the washcloth. I'm going to put it in, wring it out completely, and then I'm going to unfold it and put soap on all surfaces of this. It'll probably be pump soap when you take your state test. But if it's bar soap, this is how we would do it. I'm going to fold this up into my washcloth onion so that I have multiple clean surfaces. With the washes, I have 3 here. The first thing I have to verbalize is that we are separating the labia because we're going to wash from top to bottom. Here we go. First wipe from top to bottom, straight down the middle. Let go of the labia, change surfaces. My second wipe, there's no need to hold the labia open, is on the side furthest away from top to bottom. change surface, and my third and final wipe is the labia closest to me from top to bottom. I'm done washing in the front, so I'm going to put that washcloth in the hamper. What I wash, I rinse. I'm getting my rinse cloth ready, and I'm going to fold that up into my onion. I'm going to rinse in the middle from top to bottom. I'm going to separate the labia top to bottom. Change surface. My second wipe is labia furthest away from top to bottom. My third wipe is labia closest to me from top to bottom. What I wash, I rinse. I'm done with this washcloth. It's going in the hamper. What I wash, I rinse. What I rinse, I pat dry. And I'm going to try to use different parts of this dry towel to dry my resident, making sure not to cross-contaminate. I'm done with the front of my resident. So now I'm going to put the towel over here. I'm going to help her unfrog her legs. I'm going to roll her over onto her side. Kendra, I'm going to help you roll onto your side on the count of 3. 1, 2, 3. All right, I'm making sure that her feet are not exposed, and I can reposition this bath blanket as well as I can to make sure that she stays a little bit warm. Let's reposition this towel for drying right along her bottom. There we go. Now let's get our new washcloth. This is for her backside only, and there's only one wipe. We wring out the washcloth, and again, we are going to unfold it completely, get soap all over all of the surfaces, flip it over, get soap all over those surfaces. There's only one wipe here, so we could fold it up into the washcloth onion, or it doesn't really matter if we wanted to leave it unfolded. We have to wipe from the vaginal area to the rectal area and up the back. So from crack to back, one wipe only, and that's all we have to that. Next, let's get our rinse cloth. What we wash, we rinse. Wring it out completely, and we can do our washcloth onion if we choose, from vaginal to rectal and up the back. What we wash, we rinse. What we rinse, we pat dry. And again, we're using different areas to make sure that there's no cross-contamination. And we're done with our dry towel. Now that she's on her side, we do have to remove this incontinent pad. And let's roll this up and tuck it underneath her. Kendra, I'm going to help you roll over onto your back. 1, 2, 3. It's a little bit of a bump there. Let's cover her up for some privacy and dignity. And I'm going to walk around the bed. Now her bed is in high position and she needs to be safe. So I'm going to keep my hands on her at all times and move quickly. Kendra, I'm going to help you roll over a little bit on this side to get the rest of that incontinent pad out of there. Of course, I would never pull it. I'm going to put that in the hamper, but I'm just going to reposition her a little bit. Again, I'm holding onto her. All right, we are done with our wash. So let's cover her back up and let's take this bath blanket out very carefully. I am ready to get rid of all of my supplies, but before doing that, I have to lower the bed. I'm going to use my knuckle. I can come back and sanitize this later. We have to make sure that she's in a safe position before I walk away from her. Going to the bathroom, I'm going to pour her wash water into the commode or a toilet if it's a toilet there. Just like we washed, rinse, and dried our resident, we are going to wash, rinse, and dry our basin. The wash water goes in the commode or the toilet. The rinse water goes in the commode or the toilet. We're shutting off the water with that paper towel, and we're getting another paper towel to dry our basin. Basin gets washed, rinsed, dried. Coming back to our resident's bedside, we're just going to put the soap in here and put our materials away. My last dirty supply is my barrier. I fold it up neatly and put it into the hamper. I'm done touching all of the dirty supplies, so now I'm going to do my evaluated hand wash. Let's take off our gloves. We're going to make a little slack by putting our hand like this, and we're going to go dirty to dirty, wadding it up, and we go over the back of the hand, clean to clean, and then our gloves get pulled inside out. We're going to put these in the trash. Let's do our evaluated hand wash. I'm going to take off my watch and set that aside. Using a barrier paper towel, I'm turning on the water, and I'm going to adjust the temperature. That feels about right. My hands go in and spread with my fingers, finger spread, and I'm going to rotate. Drip, drip, drip. I'm going to do soap on both hands. Wrist, wrist, back of the hand all the way down to the fingertips, back of the hand to the fingertips, the palm of the hands. Next, I'm doing each individual finger rotation on both hands. Next, I'm going across the cuticle on each hand. My fingers are pointed down. My tummy is not touching the sink. I'm going to scratch on this palm. I'm going to scratch on this palm with my fingers on the opposite hand. And then I'm going underneath each individual finger. My hand wash has to be at least 20 seconds long, and I'm at that point. So I'm going to rinse by putting my hands in, rotate, my fingers are spread, my fingers are pointed down. And I'm in, spread, rotate. We're going to drip, drip. We started our fingertips and we go up, drop that in. The back of the hand. We go, always start at our fingertips and we go in an upward motion. Fingertips, upward motion. We're going to take one last paper towel to shut off our water, and we don't crumple it. That's our evaluated hand wash. Now we're coming back to our resident, and the only thing that we have left is our safeties. My 3 L's. The bed is still locked. It's still in the lowest position, and I need to give her call light. Kendra, is it okay if I put your call light in your right hand? And she says it's fine. We don't have to do comforts for the state test. At any time along the way, I can make a correction, but I think I'm all right. So I'm going to open my curtain, sanitize my hands, rubbing until dry before I say that I'm done.